So hello friends, welcome to back my YouTube channel. In the series of endocrine system, in this video we are about to discussing thyroid gland. As we know, this topic is little difficult, so you please don't skip this video and watch completely. So without wasting a single minute, let's start the video. The thyroid gland is one of the largest endocrine gland, around 15 to 20 grams in adult. It resembles a butterfly in shape. This gland is situated in the neck in front of larynx, which is voice box, and trachea. The name thyroid was introduced by Thomas Wharton in 1956. The arterial blood supply to the gland is through the superior and inferior thyroid arteries. The thyroid gland basically secretes a three hormone, which is triiodothyronine, tetraiodothyronine, and calcitonin. Iodine is the essential component for the formation of thyroid hormone. That's why in the case of thyroid abnormalities, doctors prescribed you please consume iodinated salt in your daily life. The thyroid gland selectively takes up iodine from blood, a process called iodine trapping. The thyroid gland is composed of spherical sacs called follicles. The thyroid hormones are stored in the lumen of these follicles. The wall of follicles is made up of cuboidal epithelial cell called principal cells. These principal cells secrete two hormones, which is thyroxine or tetraiodothyronine or T4 and triiodothyronine or T3. Between these follicles, there are some different cells have been found, which term as parafollicular cell, also called C cell. These parafollicular cells secrete calcitonin. Now we come to the next point: regulation of secretion of thyroid hormone. Some factors like exercise, nutrition, low blood pressure, and sleep stimulate the hypothalamus. This stimulation is also known as the positive feedback. Then, when these factors stimulate hypothalamus, hypothalamus secrete thyroid releasing hormone. This thyroid releasing hormone acts on anterior pituitary. Due to this, anterior pituitary secrete TSH, which stands for thyroid stimulating hormone. This thyroid stimulating hormone stimulates the thyroid gland. After that, thyroid secretes the thyroid hormones, which are T3 and T4. These T3 and T4 level have raised in blood. Then these hormones are used by the most body cell, and this raised level of thyroid hormone inhibits hypothalamus and above secretion have been stopped. This inhibition is termed as negative feedback mechanism, and when the thyroid hormone level have go down, then it stimulates hypothalamus and above process again started. According to the high and low level of thyroid hormone, positive and negative feedback mechanism continuously performing in our body. Now we discuss the functions associated or performed by the thyroid hormone, in which first is it increases the vessel metabolic rate. Vessel metabolic rate is defined as the rate of oxygen consumption under vessel condition by stimulating the use of cellular oxygen to produce ATP. When the vessel metabolic rate increased, cellular metabolism of carbohydrates, lipids, and protein have increased. The next function of thyroid hormone is stimulate the protein synthesis in our body. It increases the use of glucose and fatty acid for ATP production. Thyroid hormone stimulates the lipolysis. Lipolysis is termed as the fat's breakdown into its constituent by hydrolysis. Thyroid hormone regulates the development and growth of nervous tissue and bones. These hormones enhance cholesterol excretion. The hormone calcitonin, which also known as thyrocalcitonin, produced by parafollicular cell, act on the bone and the kidney to reduce blood calcium level when they are raised. Some fact associated with thyroid gland, in which first is mycalcin. Mycalcin is 10 times more potent than human calcitonin. Is prescribed to treat osteoporosis. Osteoporosis is defined as the brittle and weak bone due to lack of calcium. Edward Kendall in 1945 was first to isolate thyrotoxin in crystalline form. Secretion of thyroid hormone begins about the third month of fetal life and it increased at puberty and in women increased during pregnancy. When the supply of oxygen is deficient, excess of thyroid stimulating hormone is secreted and there is proliferation of thyroid gland cell takes place and enlargement of thyroid gland. This is known as goiter. Now we discuss the disorders which associated to thyroid gland, in which first is cretinism. Hyposecretion of thyroxine during birth or growth years may lead cretinism. Cretinism, also called childhood hypothyroidism. Two important symptoms are dwarfism and mental retardation. The second disorder which associated thyroid gland is hyperthyroidism. Hyperthyroidism is also known as thyrotoxicosis. Hypersecretion of thyroxine hormone may lead hyperthyroidism. The third disorder is hypothyroidism. Hypothyroidism is defined as the hyposecretion or less secretion of T3 and T4 in our body. Some symptoms are included in hypothyroidism, in which first is tiredness, second is weight gain, and third is anorexia. Anorexia is defined as the fear of gaining weight. The next disorder is Graves' disease. Sometimes it also called Graves' thyroiditis. It is autoimmune disorder in which an antibody that mimics the effect of thyroid stimulating hormone is produced, which cause hyperthyroidism, goiter, exophthalmos. Exophthalmos is defined as the bump of eyeball due to deposition of fat and fibrous. The next disorder is goiter. Goiter is defined as the enlargement of thyroid gland without signs of hyperthyroidism. It is held due to deficiency of iodine. The next disease is Hashimoto disease. It is an autoimmune thyroiditis discovered by Japanese surgeon Hakon Hashimoto in 1912. It is characterized by the production of antibodies in response to thyroid antigens, also called suicide of thyroid. The next disorder is thyroid nodules. Formation of lumps inside the thyroid gland is known as thyroid nodules. So, thanks for watching this video. Please subscribe to our channel and keep in touch.